be with you guys. I like to clap to get energy flowing and going. My name is Shannon Robinson. I'm a licensed clinical social worker in the states of Virginia as well as Georgia. I'm also certified in integrative mental health. So when we say integrative mental health, we're talking about the mind, body, soul, spirit connection. We're also referring to complementary alternative medicine. So that might be a new term. We're going to break that down a little bit. CAMS, or complementary alternative medicine, basically means utilizing non-medical or non-pharmacological supports to ensure that you are doing well. Another term that we're talking about is lifestyle medicine. Is anybody familiar with the term lifestyle medicine? Okay, so not so much. So lifestyle medicine is utilizing the natural resources that you have within yourself and within the environment to foster a sense of healing and wholeness, okay? So that's one of my roles, is to assist with integrative mental health. I'm also certified in clinical anxiety, okay? I have worked with a whole bunch of anxiety disorders. We in the anxiety realm or the field, or we call it the anxiety spectrum disorder. Because again, we have it all the way from as low as anticipatory anxiety or healthy working anxiety, all the way up to what we call even panic disorders that are anxiety driven or based. As well as I'm certified in clinical trauma. So working with individuals that have experienced trauma throughout their lives, whether it's called, we call it chronic trauma, which stems from a single event, or if it's childhood trauma or developmental trauma. I have been in the field for about 12 years, and I've worked with a whole bunch of populations, different backgrounds. So I'm really excited to meet with you guys today, because these are the things that I've gained. It's not just knowledge that I've researched, but this is practice-based that I'm providing to you all today. So let's dive into it. A holistic approach to anxiety, okay? So before we get started, and I gave you guys an intro, when you think about holistic, okay, and this is going to be very interactive, okay? I'm a therapist. I work for Grady. I've worked within a multiplicity of settings, one-on-one, and then, of course, group trainings and so forth. So if you want to yell out responses, you're more than welcome to do so. So when you hear the term holistic, what comes to your mind? Anybody? You're fine. The whole person. Very good. We're looking at the whole person, right? What I love about holistic is that it's saying we're connecting all of those parts that feel divided. A lot of times when we are engaging ourselves, we think of ourselves as, different roles. And that's true. We do operate in different roles, but we're also a whole system. Just like everything in this world operates and flows on systems, the human body or the human being, the living soul, is a system. And so when we're addressing that system, we want to ensure that we're connecting all of those pieces together, okay? So let's look at the disclaimer. First and foremost, yes, I am a mental health professional, but this training is intended to be informational. It's not intended to replace your medical provider. It's not intended to replace your mental health provider. The goal is to provide you with more understanding, more knowledge, more comfortability with the different types of resources and tools that are out there, as well as more what I like to utilize tools or toys for your toolbox, or tools, well, let me back that up. Toys for your toy chest, and tools for your toolbox. So this is the goal, to give you those resources, okay? And again, it is self-help in nature. Next, our objective therapeutic gains is to learn the truth about anxiety, because anxiety is probably one of the #1 diagnoses in the United States of America. It is actually. And it's very prevalent among a particular gender. And if anybody wants to take a guess, does anybody want to take a guess what that gender may be? What do you think anxiety is most prevalent in? Women, exactly. Anxiety is most prevalent in women, and we'll talk about that. And then we also want to learn about the different ways anxiety has developed within our experience. A lot of times people don't understand that this, when we have the diagnosis of anxiety, is totally different from having natural anxiety that's designed or has been formed in the brain to provide you with the support you need to ensure safety. So we're going to talk about that. We're going to talk about the two different main branches of anxiety, the neuroscience of anxiety. One of the things as a mental health professional, you have to know the science behind the art, okay? So we are not just sitting with you when you're going to see your therapist or a professional. We're not just sitting with you and talking to you from what we think. Yeah, we do. But it's really we're looking at the neuroscience, how this nervous system, how the brain is connected to the nervous system to have us experience what we're experiencing, okay? And then again, the multi-dimensional approach to anxiety, how it affects us, as well as how we can receive resources to tap into the mind, the body, the soul, spirit, the environment to support us in our wellness, okay? And at the end of this presentation, we're also going to utilize and identify different resources. All right. So again, if you have questions, you can hold on to your questions. Since we have a small group here today, you're more than welcome to yell them out, because again, I am a therapist and I enjoy and I appreciate, connection in that way, communication. All right. So what is anxiety? All right. The APA says that anxiety is basically a different experience that we have in the human being, where it's characterized by fear, racing or ruminating thoughts, or it's causing us to feel like there is a physical change within our bodies that makes us feel extremely uncomfortable. When we utilize the term APA, we're talking about the American Psychological Association. Now, all the persons that I'm identifying today, the different organizations, these are the leaders in the thoughts and how they form the concept of anxiety. Another one is WebMD, also asking what is anxiety, and their response is it's a natural emotion that we experience that causes different discomforts within our body. And then anxiety is also defined, according to the National Institute of Mental Health, as tension or uneasiness or that comes from or stems from a sense of feeling danger or threat, okay? Internally as well as externally. But what I like to say, to make it easy, because a lot of times when we hear all this jargon, it comes really confusing. What anxiety really is, it is an alarm system within your body, in your mind, that trickles down to the rest of your body, okay? It affects you on a mental, emotional, spiritual, psychological experience. And symptoms will show up for the purpose of trying to warn you. So if you're familiar, anybody familiar with a clothes dryer? Yes? Okay. What happens when you put the clothes in the dryer? What happens? And it's trying to warn you that the clothes is done. You hear a beeping noise. Well, that's exactly what anxiety is. At the bare basic, without a diagnosis, without trying to figure it out and be all, psychological with it, so to speak, all it is a beeping noise to let you know that something needs to be done, okay? Bare basic. So for example, if I was going with my husband on a vacation and we were getting ready to dive into a deep part of the ocean and I saw a shark, I would want anxiety to alert me. I would want to say, oh my God, Shannon, there's a shark. Beep, beep, beep. Time to get out of that water. Healthy approach to anxiety, healthy experience of anxiety. If I'm walking down the street, I'm getting ready to cross the street, and then all of a sudden a car is coming, and then a beep, 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 beep starts in my head, in the amygdala. We'll talk about the amygdala, going down to the rest of my body, those physical sensations, butterflies in the stomach, tightness of your muscles, that discomfort shows up. Oh my gosh, that's an alert to say, I got to get out the street before this car hits me. Natural experience. We all have to have anxiety, okay? Now, the issue is the overactivity of that anxiety, okay? At times, when it's overactive, that's when people get really, really afraid and uncomfortable. So the goal is how, and I don't want to get ahead of myself, how can we use our natural alert system to support us in a more healthy way, especially if we're struggling with anxiety disorder, okay? All right. So again, like I stated, we all have anxiety. We all experience it at different levels. There is a stark difference, and I could tell you this from practice-based experience. I don't know how many times I've had people come to my office, particularly working in the cancer center. That's what I do. I'm a mental health therapist, or in Georgia we call it behavioral health therapist. Uh, Constantly working with people that have cancer. And doctors will refer them to me. Shannon, I need you to see this patient. And I'll see the patient, and they'll say, because this person is crying, they've been crying for 3 weeks, and they're worrying. And so we're really concerned about them, right? And so when the patient tells me what's going on with their experience, I say, well, yeah, of course you're going to be anxious. You you just got a cancer diagnosis. That's you're supposed to have that experience. Why? Because your body is trying to tell you, okay, something needs to be done here. Remember, anxiety is an alert system for danger, for a potential threat. So if you're diagnosed with cancer, okay, if you're experiencing something uncomfortable or there's a potential, anxiety will show up. The goal is not to try to dismiss it. Sometimes we can over-pathologicalize. That's what I tell the doctor. Let's not over-pathologicalize this. This is a normal experience that we have to listen to. Case in point, if you're driving and you hear somebody honking their horn behind you, what's your first response? You're going to see why, right? Because you could be driving into, an elderly person that's trying to cross the street, or could be potentially crossing, a red light. That could be disastrous. So again, we don't want to dismiss those cues. We want to honor those cues and tap into them and see what we need, okay? Now, again, that's when anxiety is working in a natural way, in a healthy way, anticipatory way. The issue is the overactivity of anxiety. Now, when anxiety, which we naturally have in our body, our mind and body system, when that is overreacted, it's due to various reasons. I can tell you firstly, a lot of times the overactivity can stem from what we call a genetic disposition, or I personally like to say a genetic vulnerability. Meaning that someone within your family, generally your mom, okay, the person, not always, but generally, had a disposition or was an anxious person. So in utero, when she was pregnant with you, she experienced life through a state of anxiousness, or high in stress-inducing situations. And again, anxiety is an alarm system, right? Naturally. So if we're always stressed out, if we're always going through traumatic events, it's going to trigger us. Bam, 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 we got to do something. Now, if mom is pregnant, next slide, please. If mom is pregnant with you, and you're constantly feeling that discomfort, you're constantly experiencing those alarm systems and those bells going off, guess what's going to happen to the child that's born? They're going to naturally have a natural disposition to being anxious, okay? All right. And so that's one area. Another thing is, again, now let's say the child, maybe mom was doing great, she had a great pregnancy, no issues there, just normal stuff, normal life stuff. And then the child is born, and for whatever reason, this child experienced childhood trauma, okay? And there's all different types, and we're not doing a trauma focus session today. We will future. But today, let's say that they experience what we call an attachment concern or attachment disorder, okay? When we look at attachment disorders, thank you, we're looking at attachment theory. There are two main branches of attachment. First, there is a secure attachment, which is where mom is loving and caressing, or the primary caregiver, or the caregivers, plural, are loving, caressing, and nurturing. What happens in that environment when a baby is loved and caressed and cared for, they experience three or more things, and I'm going to identify the main things: a sense of safety, a sense of love, and a sense of security. And I like to add a sense of identity, because our identity stems from our family of origin, right? So those are the 3 to 4 things that they experience, which will naturally cause the anxiety experience to relax. Why? because inside of our bodies, we have something called stress hormones, and we'll talk about that. But when the child is secure, that sense of discomfort is then neutralized by the caress of a loving parent, mom, caregiver, whoever that is. However, if that experience is not cared for and neutralized or tended to, what happens is what is developed is an insecure attachment, okay? And there are three different types of insecure attachments. There's the avoidant, the ambivalent, as well as they say fearful, disorganized, but I just like to say disorganized attachment. When you're ambivalent, an anxious ambivalent attachment, that means that your caregiver was, one minute they were there with you and the next minute they're not. It's like this inconsistency. Let's look at it from this perspective. One minute, let's use military. I don't know if we're familiar with the military experience, but as someone who was prior military, I can tell you, if a mother had the baby, caring for the baby, loving on the baby, and then she's gone, and then she comes back, and because of work and life stresses and everything that's going on, and she's not showing up the way that she should, because that we need that exchange. Babies need that exchange. Children need that exchange. That can cause an anxious ambivalent attachment. And so what happens is that child is either 1 minute really, really clingy or 1 minute really, really disconnected. Now, that child doesn't unlearn these things unless there is someone in their life that can show them a secure attachment, a sense of safety, a sense of love and connection, sense of security. But if that is not mitigated, what happens now is that this adult is extremely triggered by someone who's there and not there. And then they themselves may demonstrate behaviors of being there and not there, feeling like they have to be a high performer so they can receive affection from somebody else, feeling like they have to present or look a certain way so they can receive that affection from someone else. Next one is the avoidant attachment. Now, this particular kiddo, their mother or caregiver, whoever, they was not there. And one of the worst forms of abuse is neglect. So whether they weren't there physically, because you could be in a place physically, but not be there emotionally. And so if they're not there emotionally, there's a disconnect there. What happens is that this kiddo operates from a space of being to themselves, not wanting support, not asking for help, not feeling like they need help because they can't trust the world around them because they learned from their caregiver, mother, whoever, that I have to be autonomous. I have to do things for myself, which can cause that person to be an anxious person as well, a high performer, high achiever. This person is never looking for any support because they're anxious. They see that as a threat, that if I ask somebody support, I might get hurt because they're not going to show up for me. And so these are the types of things that happens in the attachment. And the last one is the disorganized. Some people call it fearful disorganized. I'll use the disorganized attachment. This is a trauma-based attachment. This is where sexual abuse may show up. This is where, and there's so many types of trauma. You have big T's and little T's. Whatever causes, what I like to tell people, whatever causes your full self to be completely dysregulated, that's your trauma. And that even in itself, some people who've experienced a childhood trauma or childhood traumas, adverse childhood experiences, that even in itself doesn't necessarily have to demonstrate as a post-traumatic stress disorder or trauma-related disorder. It can also show up as anxiety. Why? Because that anxiety was overreactive for the purpose of trying to protect themselves from whatever the abuse or the discomfort came from, the trauma came from, okay? Any questions, thoughts at all? Okay, we're good? All right, let's keep going. Another area that causes high anxiety, causes overactivity of anxiety is high expectations, high demands. A lot of Fortune 500 owners, individuals that are like in high level positions, a lot of these individuals experience high expectations. A case in point, I work with and I provide therapy to in my private practice, a lot of medical providers, nurses and doctors. And because they are trained to be Johnny on the spot, Because they are trained to think on a swivel, because of how they are wired, so to speak, to operate in their roles, they are required to always operate at a high functioning level. So sometimes when they feel like they're not meeting expectations, again, that anxiety shows up and say, okay, did you do this when you were in the emergency room? Or did you make sure that this patient, did you do this? Or are you taking care of home life? Or did you constantly this alert system going off? And then last but not least, and I'm just identifying the main four, social isolation is one of the hugest risk factors and proponents for anxiety. Why? Because anxiety, again, if you go back, if you look at origin, the way that we mitigate and we kind of normalize and we shape the fabric of our anxiety experiences is through connection. And we'll talk more about that, one of my favorite tools for assisting anxiety. So if someone is stuck in a room or stuck behind a screen or stuck in and you can be isolated inside a room with thousands of people, okay? And so when there is a sense of isolation to your selfness, I'll use that terminology if there's such a thing, that can also cause you to be anxious. Why? Because you never learned the skills or you doubt your skills of how to interact with people in a healthy way. So you're always second guessing yourself, okay? Am I engaging appropriately? Did I say this right? Did I say this wrong? So instead of wanting to be intentional about stepping out, persons that experience anxiety will step back and experience social isolation, which would make it worse. Okay, so we talked about attachment styles. So we'll keep going. And so if you guys would like to, we can take a 10-minute break. If you feel like we don't need a break, we can keep going. All right? We can keep going? Everybody's good? Keep going. Okay, beautiful. Okay, so we're going to keep going. Now, we're going to look at the neuroscience of anxiety. I love neuroscience. Again, when we talk about anxiety, there are two types. You have body-based anxiety and brain-based. At the top, when we look at the amygdala is the area in the brain, and I'm going to use my hand as an example. They call it the triune brain. I just call it the three parts, whatever terminology. There's so many different types of research. I'm going to use the term three parts. There are three parts to the system of the brain. You have right here the brainstem. This is the part that generally that controls our breathing, our muscles, things that we don't think about that we just do. Okay, when we fall asleep, okay, when we are breathing, when we're eating, those are just natural responses that we experience. That's our brainstem, exactly. Then when we look at this part of the brain, which is the limbic system, this is the part that controls the amygdala, or the fear center of the brain, the emotional sense of the brain. The amygdala, we have two of them. And what happens is, both sides, amygdala, what happens is this is a natural reaction that we experience. So when you talk about the autonomic nervous system, it's stemming from here and going down here to cause that fight, freeze. But when we're looking at the style of anxiety, we're looking from the face of the limbic system. That what happens is the amygdala is triggered and is telling us to this we experience fear or anxiety.
Can you spell that?
Say again.
Can you spell that?
The amygdala?
Yeah.
Yes, it's actually on the screen. It's AMYGDALA. Okay.
I can't see.
That's okay. You're fine. Okay.
I see neuroscience of anxiety. Where does it say amygdala? Is that something really small?
No, it's right above the brain.
Oh.
You see where it says it has the pink structure of the brain? At the top, it has amygdala function. Okay, awesome. So with the amygdala, what happens is it tells us this is where they call it the fear center of the brain. This is where we experience that rush. And what happens here with the amygdala, we get our input from our sensory system. All right. So we get our input from our eyes, our ears, our sense of smell, taste, and touch. That activates the amygdala to say, oh, wow, That's body-based experience. Then at the top of the brain, we have the cortexual brain. This is where we get brain-based anxiety. Okay, so going back, brainstem is automatic responses. The limbic system is when we have integration from our sensory system coming inside to us. And then the cortex is where we have that experience of brain-based anxiety. What happens with the cortexual brain is a lot of our triggers that are anxiety-based stem from thought, what we're thinking. So whenever we're treating anxiety, the goal is to determine, is this body-based or is this brain-based? Right? I've worked with patients that they come in and they say, somebody, and we have this is a well-known treatment modality, and if you are a CBT user, I'm not coming against you. I believe in utilizing all approaches, which is a treatment modality. But if a patient comes in and they're saying, well, I've tried all the CBT. I tried to reframe my thoughts. I tried to think positive. I tried to, ask myself all these questions. And for whatever reason, I'm still feeling anxious. And there's no threat in place. And I'll say to that person, why you're feeling anxious is because your experience is not brain-based, it's body-based. So what happens is your amygdala is bigger than your cortexual brain. Your cortexual brain is where you are. This is what we call a high executive functioning. This is when we think. This is when we make our decisions. This is where we determine what's correct and what's not correct. Okay? What happens there, if your cortexual brain is shrunk, okay, and this show has shown research that different parts of the brain structure can either enlarge or get smaller based off of its activity. So if our cortexual brain has shrunken, that means the amygdala is bigger. So instead of, which is how it's supposed to work, you get cues from the outside or cues from within yourself. Instead of cortexual brain saying, no, that's not a shark, Shannon, when you're swimming, that's actually a goldfish, you're going to automatically experience fear if the cortexual brain has shrunk and the amygdala is largened, okay? Now, so I'll tell that patient, yeah, we've got to teach you how to relax your autonomic nervous system. We have to teach you strategies how to relax the mind and body system. And once that person is able to regulate that discomfort, then if they are, because I can tell you from experience that when someone's nervous system is relaxed, those thoughts of, oh my gosh, fear, they naturally go away. And if they do continue to present, then we can start really working on our thought processes and how we function and flow and do things, okay? So again, there's a difference. There's body-based anxiety, and then there is brain-based. Body-based stems from the amygdala, okay? Brain-based is cortexual, okay? All right, next. So we are all comprised of what we call neurotransmitters. Within the brain, there are the brain is structured to do certain tasks and experiences. And there is a statement by one of the fathers of this profession was, whatever wires together, fires together. So if you're constantly in a state of anxiety, the brain structure within that causes that anxiety is going to be more active. Okay, and they have done tests and trials to see different parts of the brain structures that if it's not lighting up, that means it's dormant because of lack of activity. And if it's lighted up, that means that it's overreactive, or it's lighting up too much, it's overreactive. So when we look at our neurotransmitters, there are different types. And again, I want to put a plug out there. We need all of our experiences. Anxiety is not bad. Emotions aren't bad. All of our experience it's not bad. It's what we do that causes us to experience that discomfort, what we do or we don't do with it, okay? So again, we need our stress hormone, which is called cortisol. We need that. Why? Because stress helps us to complete daily tasks. If I'm sleeping, one of the ways that our bodies go back into our sleep cycles, and which is another thing that affects anxiety, the way we go back into our sleep cycles is that we experience more melatonin in the evening at night, And then, of course, our stress hormones, which is cortisol, lowers. And then guess what wakes us up? Our stress hormone, cortisol. So we need to have that balance. I try to stress this because a lot of times people will just try to push these things out of their lives. That's not the goal. The goal is to be in balance and harmony with it. So when we look at anxiety, that cortisol, norepinephrine, adrenaline, that those different hormones will get active and send messages to the brain, from the brain to the rest of the body, that we have to do something. Okay? Natural human experience. Now, when it is overreactive, when I am responding to a shark, to a goldfish, the way that I would a shark, now I have to start looking at how can I reduce that stress hormone, that cortisol that is overactive, that adrenaline that is overactive. And that's, again, incorporating lifestyle medicine. And we'll talk about the 4 that I like to utilize the acronym DOSE. D stands for dopamine, O stands for oxytocin, S is serotonin, and E is endorphins. Dopamine is that reward system. So when you experience a dopamine hit, and again, they utilize a lot of the drugs, whether it's prescribed or it's street prescribed, they all stem from natural hormones in the body, that concept. Dopamine is that reward system, okay, that gets us motivated and going. Oxytocin is our love and cuddle hormone that makes us feel safe and connected, okay? Serotonin is the hormone that helps with mood balance and stability. And then E, endorphins, is a natural painkiller that we naturally experience in our everyday lives if we're intentional about it, all right? One of the most powerful tools, again, tapping into my spiritual self, that I've appreciated about learning about anxiety, again, identified as the fear center, the amygdala, okay, when that's experienced, one of the greatest ways to minimize that discomfort of anxiety or cause that anxiety to completely dissipate is from touch, okay? So utilizing the resource of touch. Why? Because touch, hugging someone hugging you, you petting the dog, being comforted, pat on the back, encouraging words, automatically causes oxytocin, which is the love hormone in the body, the cuddle hormone in the body, to cause that cortisol, that stress, to go completely down and out. So again, tapping to my spiritual self, when the Bible says that perfect love casteth out all fear, that can even be proved on a neuroscientific level, because that's actually what happens. All right. Next slide. So this is a video that basically talks about what I shared with you all, but we won't have to watch it today. If you want to, I'll send you the resource.
Do you have a handout?
I can definitely print this out for you. Yes. Okay, next. Now let's look at the different, for me, the way that I am as a provider, I like to utilize language that does not feel threatening, especially with working with people that are anxious or have anxiety disorder or trauma. Why? Because our words, again, going back to our whole old child life days, words can hurt. Sticks and stones break your bones, but that concept of words will never harm you, that's not true. Words do hurt to the point where it can even change your DNA. So I like to be, as a practitioner, I like to be extremely mindful of how I utilize my terminology, the way that I communicate. So when we're looking at multi-dimensional, okay, meaning the mind, the body, the soul, spirit, when we're looking at signals, I don't like to say symptoms. Why? Because all of our symptoms, our signals, have a space and a place. Okay? I would never know that my husband needs something if I didn't see him crying. Right? I would never know that someone in my community needs support if they didn't do something to say, "Oh, this hurts." Those are signals. Yes, they can be called symptoms if we utilize the medical model, but they're signals. They're intended to communicate. I would never know that I'm struggling, if, let's say, hypothetically speaking, I'm struggling with anxiety, if I don't feel the discomfort in my stomach and the tightness in my chest. It's talking to me. So the question is, not to say how can we get rid of them, these signals, is what are these signals trying to say to us? Okay? What are they saying? And it makes me, I pause here because I'm trying to think about how to say this in a way that is balanced. But a lot of communities, because of past generational trauma, because of past situations or the way they were raised, they were always encouraged to just kind of suck it up, if I can use that term. I apologize if that's offensive. But they were just kind of told to just kind of hold it together. Don't speak, don't say anything. That's one of the worst ways to deal with anxiety or any type of disorder. Disclaimer. Why? Because again, your mind, body, soul, spirit system, this whole being is trying to communicate something to you. And if you're not getting the message, what happens is it gets extremely loud. Extremely loud. That's why people can start with just having anxiety, then go from an anxiety disorder, and then having an actual panic attack or panic disorders. Why? Because there was some message that was trying to come across that throughout these different phases, that communication was not heard. So the goal is to be aware and to listen. Get connected to yourself and someone else. So looking at the system, and again, incorporating that neural piece. So neural, body, mind, soul, and spirit. So let's look at those signals. When we're looking at the signal from a neurological perspective, the first question is, when you're assessing yourself, again, utilizing your tools for your toolbox or toys for your toy chest. Is this area in threat? Am I in threat in this area? Is this area threatening to me? Am I in immediate threat? If that person asks themselves that question and their first response is, yes, I am in threat, the next step is to ask yourself or that person, okay, so where is the danger? Where's the danger? Again, because our brains are consistently scanning because of the way we are wired and because of, and I don't want to incorporate too much of my underpinning religiously, but because of what has happened to us as human beings, okay, we are constantly looking from a fear-based perspective. So the question is, where is the fear? Where is the threat? Where is it? And if there isn't any, why is there overactivity? So assessing from a neurological perspective, right? Next question is body, okay? If I'm walking down, the next symptom for body is that you can experience headaches, you can experience racing heart palpitation, you can experience GRID, acid reflux, hyperthyroidism can also, some people will think it's actually a medical disorder, but really it's your anxiety that's really acting up and vice versa. Hyperthyroidism could be that you feel more anxious because of that, okay? Another area could be, there could be different failures in different parts and functions of the body's organs because of anxiety. IBS is another issue that is caused when we have anxiety that's prevalent within the body. Okay, so there's a lot of disruption that takes place within the body due to anxiety. Okay, muscle tension. If you're constantly trying to, you notice yourself, you take a slow down and you recognize that your jaw is always tight, that can be another reason why you are experiencing anxiety, because your body, as your mind goes, your body goes, and as your body goes, your mind goes. And if you're constantly looking from a place of fear, you're going to always be in a posture of trying to protect yourself. So that discomfort is going to show up. Why? Because our nervous system is designed to live in what we call the parasympathetic state, or rest and relaxation, or also known as rest and digest. But if you're constantly in sympathetic, if you're constantly looking for fear, those physical sensations will show up in the body, and not only in the body externally, but internally within the organs, okay? Sleep is dysregulated because you're constantly thinking, or you're constantly worrying about someone that might break in. Another area is the mind, okay? A lot of racing thoughts, okay? A lot of thinking about what I should do, a lot of pre-planning, even when it's not necessary. Now, again, anxiety is a natural response that we need, not minimizing that. It's the overactivity of it. So are you constantly thinking about what you need to do tomorrow? Are you constantly thinking about what you need to do in the past? Are you always constantly trying to figure things out as opposed to just kind of letting things flow? These are some of the symptoms that stem from a mind perspective, how we think. Are you always wondering if somebody is looking at you, and if they're looking at you, they're looking at you because of something is wrong, as opposed to maybe they're looking at you because they like the color dress or whatever you're wearing, okay? These are indications that there might be some struggles with anxiety, signals that are talking to us, and then our soul, all right? If I am always around somebody and for whatever reason, that person just makes me feel uncomfortable, and not just one person, because that's possible. I mean, that's human nature. But if you're always around people and they make you feel uncomfortable, and there is no reason for that, and you explore, or maybe there is a reason, because that's life. We live in a world where we don't get along. But if you're not able to control yourself, if you're not able to calm yourself down, that could also be an anxious response, okay? You should always, I'm being hold on, I'm being signaled in the back. Are we good? Okay. Okay. We should always, again, be aware of what's going on with us. That soul is trying to communicate. And then spirit. Let's look at the spirit. If you have a religious or spiritual orientation, one of the signs for spiritual anxiety is there is a lack, a disconnect of wanting to connect with your places of worship or your places of fellowshipping, and then ultimately your connection with God or your higher power. Again, if you're anxious to get in the presence of something that is greater than you, it could stem from the fact that you're struggling with anxiety that's spiritual in nature. Again, the question is always, starting with the neural self, is there a threat? Is there a threat? Is there a reason for this? And again, we're not judging it. We just want to understand it. Okay. So we're close to a break. So I guess we're at the break now. If you want to take a break, we can take a 5-minute break and then come back. Um, are they needing a break? Yay or nay? A break? Okay. So we're going to take a 5-minute break. Some water. So now, when we went to the break, we have a lot of online viewers. So thankful for you guys, online viewers. There are some questions that came in. So you're more than welcome at this time to ask those questions, and then we'll proceed to the next part of the presentation.
Good morning. Is it unmuted? Check. Good morning. There's a question from online. The question is, why is it so hard for your brain to shut off when you're mentally exhausted?
Absolutely. Great question. Again, you may feel the mental exhaustion. That's your body's response. Again, our sleep cycle comes from their body-based experiences, right? But our cognitive self, our contextual brain, is constantly thinking. So again, your body, you physically feel that discomfort of, oh, I'm so tired, I need to go to sleep. But cortex is saying, no, you don't. You need to do the laundry. You need to do this. You need to call so-and-so back from 5 years ago and make it right. So there's a constant war within our members that is causing this discomfort to happen. So yes, again, your body can feel tired, but cortexual brain is saying, no, we have to problem solve. We have things to do. Okay? All right. Any questions circling or regarding that? Are we good here? Did you get your answer? Okay. Let's go to
One.
second question.
Second question is, you all hear me?
Yes, we're good.
Gotcha. Second question is, how does trauma and insecurity affect your personality and brain? How
Awesome.
does trauma and insecurity affect your personality and brain?
Very good. So again, we are one system, right? So let's use an example of a child that grew up in a traumatic environment. Their brain is being trained because again, our brains are neuroplastic. When we talk about a neuroplasticity, we're saying that it has the ability to change, to adapt, and modify. So in our formative stages or the beginning stages, our brains are developing, and guess who's shaping that experience? The people in our environment, primarily if you were raised with your mother and your father, and primarily mom. So if you're in a traumatic event, it's not an event, it's an experience. And when we say experience, this is a long process of time. If you're in a traumatic experience, then your brain is being unfortunately exposed to things and it's not getting the necessary development needed as a child that's in an environment that is in a functional, loving, and caring environment. So then the trauma has unfortunately taken its effect. Now it's not just affecting brain structure, because again, you are a whole system. It's also affecting your body, even to your immune system. I can tell you there is a tool that was created by Kaiser Permanente called ACEs, ACES, Adverse Childhood Experiences. And they had a scale, and that has been adopted throughout time. They had a scale of the different experiences that can cause a child to experience, and I don't like to use this term, so don't credit to me, but credit to the others, a maladaptive experiences or behaviors. Maladaptive, mal meaning bad, so bad adaptive practices. Okay, and so now instead of someone coming to you, this kiddo, all their lives they've been slapped in the face, and I apologize if this is too much or intense or graphic, but they get slapped in the face consistently over and over again and told you're no good, you're nothing, you're a nobody. That's how they're being wired to perceive interactions with others. Guess what? That personality is going to form, and they're going to expect that is how they are to interact. Or they're going to constantly try to hide and run away. And this is where we talk about fight, flight, freeze, and fawning. I'm not going to go into that today. But they're either going to embrace that interaction. That's why we have a lot of individuals. If you do what we call a genogram in social work, we have a genogram. We look all the way back as far as we can through our, grandparents, grands, all the way down to you. You would see that there would be a pattern of domestic violence from someone who has had or experienced domestic violence. Because again, the brain was trained to either embrace it or run away from it. Okay. And so now your personality is, and even if you're not being physically slapped in the face, but you're receiving experiences, interactions from people that cause that level of discomfort verbally and emotionally, that's normal to you. It's normal. And so you live from that space. So now your personality is, you could either, you're from a place of fighter, you always want to fight, because again, you're still trying to fight the person that slapped you when you were 5 throughout your life, or you want to consistently run from that person because you're running from situations that are not even threatening, but you're still trying to run from that abuse, or you're constantly being a people pleaser, or you're always apologetic, or you're overextending yourself because you're trying to appease that person that kept slapping you. And one of the most heart-wrenching for me, because I've worked with so many of these individuals, persons that have the fawning response. You know, when they're being abused, they show more love because they just want that person to stop. And so that's why your personality, again, it's your wiring. And so your wiring dictates how you show up. And that's a good question because that's one of my Shannon isms, as I call them. But anyway, any other questions before we move on? Yes.
Can you go back to the first question where cognitively you're thinking about everything you need to do, but physically you're tired? What can one do in the bed or in? Okay. In retrospect, the first question
Absolutely.
had to do with anxiety, and you need to go to sleep, and
Right.
your mind is racing, but your body is tired.
Mhm.
What management must one seek
Absolutely.
to remediate that,
Okay.
so they can go to sleep?
Beautiful. So I'm going to give you a part of that answer because I have a whole laundry of stuff to give you for that response. So right now, the first thing that you want to do, there is 2 different types of things that we identify. And as mental health professionals, we don't explain this very well. There's coping strategies, and then there are relaxation strategies. Coping strategies is in the moment. Relaxation is to reset the nervous system. So in that moment, when you're trying to sleep, one of the things that you can do is, again, this is a holistic approach. You can take an Epsom salt or a magnesium bath. That will naturally relax yourself. If you don't feel like getting up and you just want to lay there, one of the easiest ways is tap into your favorite sensory system. And so when I say sensory system, eyes, sound, taste, touch. What naturally relaxes you? Is it hot tea, chamomile, lavender, eucalyptus? Those are the 3 top different types of herbs that help with relaxing the self, relaxing that internal system. You can drink some hot tea. Another thing that you can do is, if it is cognitive based, because it is, write a list. Okay, brain, I recognize you're telling me to do. I appreciate this information. This is my list that I'm going to address and put it aside in the morning. Another great way is to make sure that you are wrapped yourself tight in a blanket. Some people also get weighted blankets, and put it around your body. Again, that reduces the stress hormones that's overreacting, that is causing you not to go to sleep because of those thoughts. So those are 3 ways. Cognitive based, you can write them down, talk to yourself and say, hey, relax. Another thing is, if you want to take an Epsom salt bath, that's body based, so drink some tea. Another thing is a touch. Again, helps reduce the cortisol in the body, causes the stress hormones to go down, and releases melatonin and oxytocin, okay, which is, again, oxytocin is that love cuddle hormone that naturally dissipates fear. But I have more. I don't like to just, one of the things I like to tell people is that you have to retrain your body and brain system. So yes, you can do an intervention in the moment, but that is, again, that's a signal that more work, if that's consistently happening, that's a signal that more work has to be done. Okay, did that answer your question?
It does. I'm familiar with what you're saying already, but it doesn't work.
Okay. It hasn't worked for you?
No.
That's so and that's totally fine. When someone experiences, that's totally fine. I love that. When someone tells me that it doesn't work, that means that there's more work that needs to be done. So again, that's why I say the interventions, they're there to support you, but there is work. Those interventions are just there to mitigate the current need. But there are also things that need, so if you're constantly thinking about things and you haven't built strategies on a daily basis to support yourself, then it's not going to work. So there has to be not just those immediate techniques, but there has to be long-term approaches that come into place as well. So that can look like changing your diet. A lot of times the foods that we eat can also cause us to feel anxious. Another thing can be done is maybe your sleep cycle. If you're prone that you need 5 to 6 hours of sleep, and most people in society, they need about 7 to 9, and you're sleeping 4 to 3, that's going to naturally cause you to feel anxious. Another thing, if you recognize that you are a person that needs to have long extended times in the morning and you're not incorporating that, you're going to be anxious. So again, that's why I say you can utilize interventions and strategies, but then if it's not working, that means there's more work that needs to be done.
And when you talk about Epsom salt, there's also a therapy that's very popular now, even in Atlanta, where there's a lot of spas, float therapy.
Flow therapy, yes, absolutely. But in the moment, in the bed, you won't be able to do float therapy in the bed, but you can utilize that when you're, again, a part of your wellness protocol.
Right. But there's the float therapy. As a matter of fact, Seth Curry does float therapy.
Mhm.
It relaxes your muscles and your endorphins come to play. And I have fallen asleep in the float therapy spa.
Very good.
So
Awesome.
this is that relaxing.
Right. Now, what float therapy is designed to do, it's designed to cut off you from your sensory experiences. Again, the reason why people feel this discomfort is because they're walking in a world that is constantly causing them to feel stimulated. So when you're in that little space, it's literally like a pod with water in it. All your sensory systems are completely shut down, and you're having a sense of deep relaxation that causes the brain and body system to relax. But again, that is a part of your protocol. So that's a lifestyle experience. If we're trying to do things in the moment, we have to make sure that our lifestyle matches with the interventions that we're doing. Okay? Any questions about that? Okay. All right. So we already had a break. So we'll keep going. So let's look at that, which we're talking about now. So now we're looking at the body, right? We've identified float therapy. Another thing that has also been identified is Epsom salt, magnesium. Another thing that you can do is if you are not walking, walking is one of the greatest ways to help cause stress reduction in the body. Why? Because it releases endorphins, it releases dopamine, serotonin. And then if you're interacting and you're talking with someone, then again, that will release that oxytocin hormone. Another thing that you can do is stretching. A lot of different old types of stretches. When we are stiff within ourselves, we're naturally in a posture, we're stiff. We're naturally in a posture that's going to, again, cause us to think from a place of being anxious. So when we reorient or rewire this brain, the goal is to get back into a space of being more flexible and fluid. Why? Because now the body is telling the brain, because we have body-based interventions and then we have brain-based interventions. The body is telling the brain, it's okay. You can move. You're fluid. You can adapt. You can change. Another thing, again, is having a sleep hygiene protocol. A lot of people who struggle with anxiety have poor sleep quality. Why? Because again, they're constantly thinking about something. So we have to revisit that. Another area that we need to look at, which is natural, is deep breathing. More than any tool that I've ever experienced, and I've worked with a lot of people, breathing, controlling your breath and controlling your muscles is a natural way to cause you to relax. So getting really into your breath work. People who experience anxiety and trauma, they normally have short, shallow breaths. But the deeper breaths will help with more oxygenation to the body, which naturally causes stress hormones to calm down. Again, what's happening is when your brain is constantly racing, there is different what we call myelin sheets that surround the neurotransmitters. Okay, just like you've seen a wire that's frayed, the plastic is coming off, the electricity is coming out. That's what your brain looks like when when you have anxiety disorder or trauma related disorder, PTSD and the like. What happens is when you start causing that deep breathing and you're being more reflective and meditative, your breath is more regulated, it's deeper, those myelin sheets start to repair itself because again, the body is designed to protect and repair. Okay, and so it will naturally come back into a full completed myelin around those beautiful wires, and then your brain will start to calm down. Okay, from there, the next step is when we're trying to address. Go ahead. Did you want to say? Okay.
Yes. When you talk about breathing,
Mhm.
how do you breathe? You breathe heavily or?
So there's different types. Very
Okay.
good. So let's go with basic breath. When we're doing basic breath, we're breathing deep. So that's why I said in the beginning, use the concept or the idea of breathing from your toes. Why? Because when you breathe deep, you're opening up yourself. So really, if we're looking at it from a somatic experience, we're opening up ourselves. And then when we're breathing deep, we're also telling our brains that we are in control. Because again, anxiety is fear-based. It feels like when we're fearful, it's because we feel like we're not in control. So when we take a deep, exaggerated breath, that tells us, nope, you're in control and you're okay. And your body says, oh, I don't have to be tight. I can be fluid and relaxed.
Are you familiar with Wim Hof, the Wim Hof breathing method?
Go ahead. Yes, you want to expound?
Well, I did it this morning, but so I've read a little bit of his book, but it's basically breathing in. You can actually feel in your toes and your fingers the exchange of red blood cells.
Mm-hmm.
And so I used his procedure where 30 times this morning I did that, and then I held my breath for 1 minute and 45 seconds.
Mm-hmm.
So, which is really hard to do.
Yeah, it's all about growth. So the more you do something, the more natural. Again, this is about practice, building in these new systems. Because again, your brain is wired. If you're anxious, your brain is wired to respond in an anxious state. But when you do things intentionally and consistently, guess what's happening? You are rewiring your brain. And I have seen this. I've worked with all different types of disorders, particularly within the anxiety spectrum. I had one situation when there was a young lady, she had anxiety, and because of the intensity of her anxiety, her sensory system, meaning her sense of hearing, was overreactive to the point where she would hear chewing and it would trigger her. Why? Because that was her reaction. Everybody has their personal. That's why I say, you can read the literature and that's great. We want to have a foundation, but you know how you experience life. And so you have to assess what's going on with you. And for her reaction was if she heard chewing, it would be extremely loud and it would cause her to want to retreat to her room. One of the things that we did, and we'll talk about this here, I guess we can do it now. There's a technique, there is an approach called exposure therapy. One of my favorites. Now, people who generally are anxious, this is a struggle because, again, nobody likes to feel that crippling fear. But it has been proven scientifically that when you lean into something for 6 minutes, when you lean into the anxiety for 6 minutes, those signals will start to dissipate. And the more you lean into that discomfort, the more that the discomfort is not as affecting. It's not affecting you as much. I had one situation where there was a patient that she struggled with driving after getting to a car accident. So one of the things that we did was, and this is again a cognitive-based strategy, we visualized after she did her body-based stuff, stretching, eating right, changing her diet, getting on a sleep protocol. When all of that stuff was regulated, the next step was to address, because again, you want to address the need. You don't just want to do interventions. The next step was to get back into that car. So the first thing that we did was we visualized what would it be like to be in that car. It's a safe environment. There's not an actual car. You're okay. If we need to, we can tap back into our breath work. We can relax our muscles. We can identify different calming things in the room. So we call it, and I'll talk about that 5-sense self-soothing, which is a DBT, dialectical behavior therapy technique that I like to utilize. 5-sense self-soothing, as I digress. 5 things that you see, 4 things that you hear, 3 things that you taste, 2 things that you touch, and then 1 thing that you can feel, or you can switch it up. I like to encourage people to switch it up based off of what sense you like the most. So if you're more into like sound, look for 5 things that you hear. Or you can break it up to 5 for each sensory system, 4 for each, 3, 2, 1. But anyway, so we identified all her resources, internal resources, is what you naturally have, as well as her external resources, things that she can get from her environment. And we said, okay, so now we're going to mentally enter into the car. This is the beginning stages of this exposure. Visualize, what is it like? What's it like to get into that car? We gradually got into the car, and then when she recognized that her breathing was uncomfortable, she was able to, because of her awareness, because she had developed that wellness protocol, recognize that her chest was getting tight, her breathing was becoming labored. And we said, okay, let's slow down, let's take our breaths. Okay, do you feel relaxed at this time? Yes. Now let's envision sitting in the car, putting our seatbelt. And we consistently did that. Again, we're rewiring, we're retraining the brain. So now we started within the mind. Everything that we do starts here, whether we recognize it or not. It starts here. So once she was able to do those techniques without feeling discomfort, guess what the next step was? Going to a car, examining the car. This is another thing I like to encourage people. If you're feeling anxious about something, whether you have anxiety disorder or you're anxious, go into your environment first before you're required to go to that new job and get that new job and you get anticipatory anxiety because you're trying to find it. Take a day or 2 and go before. This is just normal practices that you can do. Next step was to go to that car, look at the car, examine the car, what's going on with the car. Is there anything unsafe about the car? Okay, if you're feeling uncomfortable, tap back into your internal, external resources, your interventions that you'd like to do to relax yourself. Then, once you recognize, okay, you're good to go, after you've done this how many times that is needed, you can step back into your space of being into the car. The key's not in the ignition. You don't have to do anything. You don't have to put your hands on the wheel. And after time, after these gradual practices, leaning into discomfort, then comforting yourself, leaning into your discomfort, feeling more in control. This person was able to drive again. Why? Because you are rewiring the brain. Okay, so any questions about that? Once you are doing these practices, again, it becomes easy where you're retraining yourself. Why? Because you are in control of who you are. You have the ability to reshape how you think and perceive and experience life. It all starts with, are you able to experience the discomfort? And if you do experience the comfort, are you able to allow it? Are you able to not allow it to affect you as much to the point where it won't affect you at all, or there's low levels of effect? Because again, you need to have low levels of anxiety. You just don't need it to be overwhelming. Okay, next is the soul. This is so important. When you are experiencing issues with anxiety from a soul-based perspective, you always want to start doing what is called mentalization. asking yourself these questions. You know, some people call it Socratic questioning from CBT. Really what it is you doing introspection, looking inside yourself. What's going on here? Why is this happening to me? Why am I thinking this way? Why am I feeling this way? And if I'm feeling this way, is there a natural reason for me to feel this way? Is this an expected? Is my reaction, what I'm feeling, related to or in proportion to what's going on in my environment? Case in point, if I'm in a room and I think that someone is thinking something in a negative light, the question is, are they really thinking something negatively? Or is that just my anxiety trying to warn me? And anxiety, if you're trying to warn me, I appreciate that. But what I'm going to do is I'm going to ask this person the question and see if there is an issue. And if there's an issue, this is what we're going to do to work through it. Again, warning signal, not to be afraid of, but to embrace and work through it, okay? And then, again, when we look at the soul, you want to engage in practices that makes you feel like you have purpose. A lot of times when we align with purpose, we only think about trauma, right? But trauma and purpose are not the only, purpose is not the only area that can address trauma. Purpose can also address anxiety. When we look at purpose, purpose gives us a sense of who we are. And a sense of who we are causes us to have a sense of well-being. And when we have a sense of well-being, we feel like we're not as fearful and more in control. So what can I do? And it gets me out of the room. So what can I do, right, to feel purposeful? One of the things that I loved, I was working with one patient during the pandemic, and she was anxious about everything. She did not go outside. Like, she would order her food, obviously, because it's the pandemic. I mean, you know, it makes sense. But it was to the point where it was debilitating. It was overactive. But one of the areas that we identified, I said, what is one of your motivational factors for you? What do you think will help you succeed? Like, if we're just being curious and exploring, what do you think will help you come and rise above that discomfort? And she said to me, my daughter. So, okay, so let's do this. How do you want to frame this? Again, using the mind, thinking about it. She says, one time I remember that just as a little toddler, her toddler could not swim and she fell into the pool. So instead of standing on the sideline, as a mom, her natural response was obviously to jump into that pool and grab her baby. And so anytime she felt like, okay, I'm feeling anxious, but I need to think about my daughter is my purpose. So I need to step out and go to Walmart to get the groceries if it's not being delivered. I need to step out and go here. I need to take my daughter to the, doctors. She used that motivational factor, and we celebrated it. And I always tell people this: celebrate the accomplishments, celebrate those victories. Why? Because again, that releases dopamine, the reward system, which makes you feel like you can do not just that one task, but all different types of tasks. And we celebrated that. I said, now that you've got that skill, let's transfer it to something else. And next thing you know, she was coming out and doing and completing things without even utilizing that tool. Why? Because her brain is now rewired. You can do this. We can do this. All right? Next thing, and I want to share this too, you have to have supports in place. Connect. If you're struggling with anxiety, don't allow it to keep it to yourself. Again, it's an overreactive warning signal. And so when you connect with people, they can, reassure you. They can comfort you. They can give you that oxytocin release that you need to feel loved, secure, and relaxed, so stress hormones can decrease. So you can have make it your own term, and I'll say an anxiety buddy. Someone that's there that you can check in and say, well, hey, I recognize that I was thinking like this today. What are your thoughts? Now, again, the person that you want to choose, or persons that you want to choose, they got to be trustworthy, somebody that you know is going to give you some good insight, wisdom, and connect with them. And what I love about that exchange, Empathetic listening naturally helps reduce the anxiety response. And it's a skill that you can incorporate to yourself if you're constantly around individuals that are empathetic and support you. And the next one is spirit. Looking at spirit. Now, based off of your religious or spiritual orientation, that's your choice, how you had that experience. So if you utilize prayer, and then people say, because I've worked with people who identify as Christians and different belief systems, and they say, I pray every day. And I'll say, that's awesome. It's great to have a prayer life, but how do you pray? And believe it or not, they pray from fear. They pray from anxiousness. They pray from, well, I gotta do this and I gotta go do. Okay, that's awesome. Not minimizing that. But did you allow yourself to experience restoration? Did you allow yourself to just bask in the presence of your who you believe in? Did you allow yourself to just have a moment of reflection? Or are you always trying to fight wars in prayer? Because again, that there has to be balance. There's a time for war, and then there's a time for peace. And if you're prone to always operating from a place of anxiety, your prayer is going to cause you to feel anxious as opposed to restored and balanced. Another thing that's a great way, spiritual practice, is humming and singing. Those are natural ways to relax the body, to fine-tune the body, to get that system that's back into balance and relaxation. Another thing is incorporating different material that is powerful and uplifting and makes you feel relaxed and secure. Because again, fear isn't just about feeling stressed out, but it's also feeling about not feeling secure. So what things can you say to yourself? Now, again, I say this, if you're saying things to yourself and it's not supporting you, that means there's more work that needs to be done. So again, I'm giving you strategies. We're not in a therapy session. There's a difference. Utilizing affirmations and different verses and different types of resources and inspirational tools, that can naturally rewire your brain. Why? Because your previous predisposition was be afraid. But now you're hearing language that's saying, no, I can do all things. I'm strong. I'm powerful. I'm firm. I'm grounded. Those things start to take root in you. And now that you can actually live them out. And I want to stress this. This is a whole protocol, meaning lifestyle change. I do this with every patient, and I can tell you from experience, and I've worked with people from different settings, different ethnic groups, everything. I'm not saying it's 100%, but I can tell you 90% of the time, it has worked. If you address all domains, mind, body, soul, spirit, you will not experience anxiety at the level that you do. Again, because it's not going to completely go away because you need to have anxiety, but you don't need it to where it's overreacting. And one of the things that I also like to encourage people to do too is don't look at it as your enemy. Anytime that we look at something as our enemy, our first response is to attack it or run away from it. I tell people to get curious about it. Give it a name. Give your name a brain. Give your brain a name. How do you want to ask yourself that question? One of the things that I love about curiosity and creativity is that it causes the neuroplasticity in the brain to start shifting, making more movement, making new pathways. So the question is, how do you want to experience it? How do you want to see this anxiety? How do you want to feel this? And so what that does is it gets you on top of it as opposed to being under it or trying to disconnect from it. Because the worst thing that you can do is avoid. Avoidance of anxiety is terrible. But you can engage in exposure in increments or completely just jump right into the pool like my patient did years ago. Okay, so let's keep going. Another area is your environment. I can tell you, after you've done your work, you created this wellness protocol, you've engaged in therapy, you did all of the things, and then people come back and say, I'm good, but it's just like this looming anxiousness that I'm feeling. Well, let's assess the environment that you're in. And they'll say, well, some people get curious about that. What is that? Yeah, assess the environment. Is there something in your environment that makes you feel threatened? Well, there's your source. Now, what do we need to do about it? What do you think is going to support you? That could be a person. That can be an inanimate object. That can be the way that the room is positioned. It can also be a lack of light. Maybe you need more lighting in your environment. Maybe you need less lighting. Well, I can tell you though, most people who generally run higher on the anxiety side of life, lower lightings is more supportive, okay? Maybe you need a cooler, because again, when you put yourself in cooler environments, again, anxieties, whenever you're anxious, your heart rate is consistently racing. That's one of the signs. We talked about that earlier. So maybe you need to be in a cooler environment so you can feel more relaxed and push that anxiety down. Or maybe you need some more blue and green. Blue and green are natural colors that cause the brain to feel relaxed. That's why I think it's so beautiful and amazing that the sky is blue, the grass is green, the sea is blue, the sea can be green. Why? Because they're natural colors that cause relaxation. What is your environment saying to you? Is it supporting you or is it harming you? And when you have all these things in place, don't expect the anxiety to go away. Expect it to work in a healthy way. Okay? All right. So resources. So again, tapping into these you can have these. Look at NAMI, which is the third point. They have a whole bunch of resources for anxiety. The National Institute of Mental Health has a bunch of resources. Another one is the Anxiety and Depression American Association. The gurus that I like to call them, you can go to the next slide. The gurus that I like to call them is Dr. Daniel Amen. I love, yes, he is like, oh, I love him so much. He's done over hundreds and thousands of brain scans. And from those brain scans, he was able to decipher different types of diagnoses. And then, of course, incorporating lifestyle practices. Because again, I'm not minimizing or against medication, but I do want to say this, and I'm not speaking against anybody's recommendations. I'm just telling you from my experience. There are certain medications that cause you to not feel the anxiety. So when you're trying to work on your anxiety and reshape and form your mind and your amygdala and your brain structures, you won't be able to have the same effect because the anxiety is not showing up. So the medication can help and harm. Okay, I always like to make a recommendation of stabilization, titrate down, incorporate skills. Why? Because pills don't teach skills and pills don't rewire the brain. They just give you synthetics. But again, that's just from my perspective, what I've experienced. Dr. Daniel Amen has that same recommendation. This is brain health. This is not about mental health. This is brain health. The brain is what we're focusing on. Another person that's a guru is Dr. Carolyn Leaf. I don't know if you guys are familiar with her. She's phenomenal. She's a neuroscientist as well as I think I'm trying to remember her other role, but I think she's a psychologist, but she is phenomenal. She talks about what we call cleaning up your mental mess. She's been doing this for a long time. And another person is Dr. Karen Trude. She's amazing. She created this technique called the self-havening technique, which is another body-based technique where you do bilateral stimulation. Again, going to midbrain. When we get into balance, everything relaxes. So crossing our arms, tapping back and forth, rubbing our hands back and forth. Again, what happens is this relaxation, your hands cause a relaxation response to go all the way up to your brain and you feel more relaxed. Okay, because your touch goes right to the brain. Everything you touch goes right to the brain. So those signals are being overridden. All right. She goes from the hands.
Yeah, there is a methodology called tapping.
Yes. I'm training that as well.
Right. And so I was going to ask, do you consider some of the adaptogens like ashwagandha, for
Yes,
example?
HTP, yes.
Do you consider that in the same vein as you spoke about medications?
So there's so great question. So when we look at neuropharmaceuticals, that's what they're called. They're different. They have the same experiences. They may give you the same experiences as a synthetic, as a pharmaceutical is synthetic, but they're not in the same classification. If you look at it from a scientific perspective, you will have the same experiences, but they're not in the same classification. HTTP5, ashwagandha, St. John's root, valerian root, St. John's wort, valerian root. What's another one that they also encourage? Magnesium, I think it's 5. Basil supportive. There's a whole laundry list of them that you can utilize. You can find them online. L-theanine, yes, yes, absolutely. All of those things are neuropharmaceuticals, okay? But they're not in the same classification. Question.
You had a question online. The question was, what about some vitamins shortness? I guess. Shortage of vitamins.
Within the body? Are you asking what shortness of vitamins within the body causing anxiety? Is that the question?
We're going to wait for clarity from the one posing the question, but as it reads, what about some vitamin shortness? And we're assuming that means a lack of vitamins within the body.
Yeah, absolutely. Again, I'll bring this up. We're right where we need to be. The next person that I identified is Dr. Uma Neudu. She is a Harvard-trained, first of her kind. I love her work. Nutritional psychiatrist. So she has 3 books. One is The Food Mood Connection, and another one is This Is Your Brain on Food. And the last one that she came up with was specifically for anxiety is Calm Your Mind with Food. And she talks about the different lack of vitamins, the lack of nutritional needs that are not being met due to what we call the SAD diet, the Standard American Diet. Funny acronym. And so because of that, that can naturally have us to not feel and experience a sense of relaxation or cause us to feel more anxious. And so, yes, if that's the question, if you don't have the right vitamins, then you want to assess that as well, okay? Again, that's why I said it's a holistic approach. What you're eating, how you're sleeping, who you're connecting to, the things that you're listening to, because your diet doesn't just consist of food, it's also whatever it is that you take in. And what you take in can also cause you to have a natural sense of feeling threat, which can lead to overreaction of anxiety. Okay, so with that being stated, are there any other questions, thoughts, anything that you want to share? Is there online?
So if one wanted to utilize your services, what insurances pay for the service?
So I don't take insurance. So I'm self-pay, but I am on a sliding fee scale. So I try to encourage people to utilize a sliding fee scale if they can't pay for services. Why I don't take insurances is because let me see, I can say this. I don't believe in diagnosing people for things that's not there for the purpose of insurance paying for it. So that's why I have an issue with utilizing insurances.
So there's no CPT code for
So of course there's always a CPT code for diagnosing, but let's say someone comes to me and they're not necessarily experiencing anxiety, but they're anxious because they have poor stress management tools. So what I'll do is I'll identify that there's stress management need, because again, I'm not diagnosing them. And if I recognize, because diagnosing is an ongoing process, we're assessing throughout the experience. If I recognize that we need to utilize an actual diagnostic code, then I'll incorporate that. But if it's just based off of, look, you're being anxious, you're demonstrating these things because you have poor stress management, let's work on that and then go from there. But I prefer not to utilize insurances. Again, that's in my private practice. In Grady Health System, I'm always using diagnostic tools and coding. So any questions about that? Is that clear? Or that's my orientation and I embrace it. So I apologize if other people want to use diagnosis. If that's you, you can. But in my private practice, I try to stray away from insurances for that purposes. So any other questions, thoughts?
What are the best ways to contact you if people are seeking services?
You can send me an email. My email handle should be attached to the live stream, as well as my cell phone. It should be attached to the live stream. And those are the two best ways to connect with me. Or let's just you can also put your email in the chat, and then that will be a cue for me to know that you want to be contacted.
Is Fitly Framed on any social media platforms?
Yes, Fitly Framed is on Instagram as well as Facebook. Okay. Any other questions, comments, thoughts, feelings that you want to share? Please, this is a safe space. I'm not saying we're growing in this together. So again, this is just for the purpose of us developing, growing. So you can ask questions. I want to be supportive to you guys, obviously, because this is free. Say again.
No, I'm saying basically it was answered, but I would. Sorry. Yeah, I was saying my question was answered, but I trouble with the anxiety of when I was about 19, I was rear-ended. Actually went to therapy and everything, pay a lot of money over the years it still troubled me when people drive up close to me behind me,
Mm-hmm.
even, closing up to my ears, my age. I still find myself, I don't like nobody driving close to me. And this something since this accident happened when I was in my teens.
Mm-hmm.
And they come close, and it was a real bad accident. So, spent a lot of money over the years trying to,
Work through it.
yes.
Mm-hmm. So I'll address it from a very general perspective. So when anxiety shows up at that level, it's because there's a lack of internal trust with what's going on in the environment. We shared this. Now, if you've done all the work, let's say you went to therapy and because I don't know and you don't have to disclose that. And let's say hypothetically you did all of that work. Then the next step that I would do is I wouldn't see it as this is anxiety focused. Now I will look at this from the perspective of trauma. Because again, if this is something that you're constantly around in your environment and it's just these natural cues, and even if you try to bring it to calm down and it's at the same level of intensity, because that anxiety is not going to go away. It's a warning signal. It's telling you to be careful with the car. It's telling you that it needs to be okay. When you experience that in situation and it was at a level 10 and it's still at a level 10 up to today, that's more of a trauma reaction or a trauma response. But if it was at a 10 when you were 5 and then now it's at a 3, that's just normal anxiety that's been built in within yourself. Now it's an adaptive strategy that your body has embraced. So the question is, do you want to look at it from a negative perspective, or do you want to utilize it to support you in your everyday life? If it's at a 3, you're okay. But if it's still at a 10 or if it's still high, that's more of a trauma response that needs to be worked on.
I need to ask a question about what is it when you feel like you closed in. You don't like to be closed in. Close, because one time I had to take a test in this tube thing for my back, and I just couldn't deal with going up in that tube because I feel like I was being smothered or close up. Where does that come from?
Absolutely. It was an emotional imprint. When you were in that space and you felt that discomfort, your body said, ooh, the emotions that were invoked was, I don't like this. It was dread, whatever, disgust. So that imprint is now in the brain. So anytime you're around an environment or that experience, that imprint is going to show back up. So now you're doing great. The next step is, so you acknowledge that. So again, utilizing mentalization, asking yourself that question. I recognize I feel this level of discomfort. Is this a need now? Do I need to feel like this now? Ask yourself that question. Next step is, okay, I do need to feel like this because I'm in a tight space and I don't want to get too close to people because whatever reason. So embrace it and then shake it off when you're out of that environment, that experience. Thank yourself for having that experience, that for the purpose of protecting you. But if you recognize, I don't want this, now we'll have to start doing some retraining. How do I think about this? How do I want to think about this? And how can I experience this going forward? And what will help me to bring this body-based experience or cognitive-based experience back down to where it's not at a 10? Because again, anxiety doesn't go away. We don't want it to go away, but we want it to be where it's listening to us. I tell people this. Your brain is either a baby or a cute little puppy or a cute little kitten that you have the power to train, and you can do it, okay? Any questions? Questions? Go ahead.
How can I recognize the early signs of anxiety? And what is the difference between normal anxiety and anxiety disorder?
Okay, so the normal signs of anxiety, heart palpitations, shortness of breath, this is body-based, restriction in your muscles, sweating, tightness in the stomach, or some people call it butterflies. Those are natural, standard. Then I always encourage people, just because it's standard, that doesn't mean that it's necessarily just you alone. So you want to see what else you experience when you're experiencing anxiety, okay? So that's one symptom. Those are the basic symptoms, but also get to know yourself. Because for you, I don't know who you are, but anxiety could also show up as perfectionism. So you want to know who you are, okay? Assess yourself. Next step, anxiety is a normal experience. You're in an environment, there's a need for threat to show up, the warning signal goes up, normal anxiety, bam. Anxiety is a disorder. We're looking at time, duration, and frequency. Time, duration, frequency, intensity. How long did you have this? If I was going to look at the DSM-5 TR, and they're going to have a new revision, I'm sure, soon, I will look at how long have you been experiencing this, how often do you experience this, and then the symptoms that are associated to it. And I can say, okay, well, this is an anxiety disorder. But again, you're supposed to, if I stress this, you're supposed to have anxiety, but the overactivity of it, we want to look at time, duration, intensity, and frequency. Okay, are we good? Any other questions? Okay. The reason why I always stress to people, know yourself, because again, yes, the research, I'm not against research. I love research, but you are your best resource. So you have to know what you are experiencing to know what's going on with you so you can effectively articulate it and feel it, okay? Any other questions? Are we good? All right. Thank you, guys. I appreciate you all. If you need anything else, please feel free to look at my socials as well as connect with me online via my email as well as phone. And I appreciate you all. Thank you all for coming out. And you guys have a great day.
Thank you.